I'm Dr. Guven. I'm an interventional cardiologist here at Grandview Medical Center, and today I'd like to talk to you about some of the presentations of cardiovascular disease, and particularly focusing on coronary artery disease. One of the ways to think about the heart is that it's an engine that is moving blood throughout the body. The heart gets its energy from the coronary arteries, which are on the surface of the heart. That is the way the heart supplies itself with nutrients so that it can continue to healthily pump the blood throughout your body. Most people wonder, well, why does the heart have injury or damage over time? And it's because the coronary arteries, which are on the surface of the heart, can develop atherosclerosis. What is atherosclerosis? Well, it's a buildup of disease within the vessels of the heart, which diminishes the blood flow and causes injury to the heart muscle. Now, this can occur not only in the heart, but also the vessels throughout the body, including the carotid arteries, as we talked about, the coronary arteries, but also arteries of the abdominal vasculature, where you can get aneurysms form, and also the arteries in the leg. Some of the most common risk factors for atherosclerosis include high blood pressure, smoking, inactivity, high caloric diet, and general aging and wear of these vessels over time. We think of atherosclerosis as an inflammatory disease, which mononuclear cells and other cells cause the lipid to be absorbed and get metabolized and oxidized within these vessels, causing development of plaque and deposition of plaque within the arteries. And over time, this can impede the lumen of the artery, causing diminished blood flow to the muscle. And if the blood flow all of a sudden stops due to a plaque rupture, then this can lead to a heart attack. Again, some of the most common risk factors for coronary artery disease are smoking, diabetes, high blood pressure, inactivity, and high caloric rich foods that we ingest in our diet. Think of that as energy stores that gets deposited in the arteries and causes disease of these arteries. Some of the emerging risk factors that we're seeing, particularly in women, are if women developed hypertension or diabetes during pregnancy, we find that later on that increases their risk for having events. We're also finding that autoimmune disorders such as rheumatoid arthritis and lupus also increase a woman's chances of developing cardiovascular disease in the future. So these are emerging risk factors that we are realizing in our female patients. One of the ways that we treat heart disease is in the cath lab. We place our patient on the table, and oftentimes we can get to the heart either through the arm or the leg artery. And generally, an artery should appear smooth, but sometimes if there's a plaque rupture, the artery has a sudden dead end, if you will, due to plaque rupture and clot formation, and that's what leads to a heart attack. So what we do is we put a wire down the artery and inflate the plaque out of the way, inflate the clot out of the way. Sometimes we suction the clot out, and then we deploy a stent to prop the artery open to restore the blood flow. But it's very important that patients come to the hospital as quickly as they can, because the longer you wait from when the heart attack starts, the more damage that you're going to have. So it's very important, if you do develop sudden onset discomfort on your chest, seek medical attention immediately so that we can open up these arteries and restore the blood flow and preserve some of the muscular function. Although we can certainly take care of you in the cath lab, we would much rather see you in the office. And so I'd like to take you over to the office and talk a little bit about how can we prevent these disease processes and how can we prevent heart attacks. So we saw that in the cath lab how we take care of heart attacks, but we'd much rather see you here in the office where we can take care of your heart and try to prevent heart attacks. We saw that the heart is the engine of the body, and sometimes I feel like we take better care of some of the objects that we own, such as if you are driving in a car and you saw a warning light that your engine is not working properly. It's likely that within the next couple of days or within a week that you're going to get your vehicle checked and make sure that it's working properly. But I sometimes feel that we don't listen to our bodies, and if our bodies are giving us warnings, that we don't address that and get it checked out. So some of the common signs and symptoms of heart problems are that patients can have chest discomfort, chest pressure, chest tightness. And another common problem that we see is that patients will begin to develop more shortness of breath with their activities. And those are often some of the early warning signs of heart problems. So if you have any of these symptoms, please do seek attention so that we can address those issues early and prevent heart attacks. Thank you.